The purpose of this presentation will be to explain healthcare licensure and accreditation, as well as key national initiatives targeted at improving healthcare quality. The presentation will be used by Maven Manor as an educational and training resource. Licensure is where a government authority grants permission to an individual practitioner or organization to operate in a profession. The licensure regulations ensure that the organization or individual meets the minimal standards to protect the public health and safety. A license is usually granted after a form or exam or proof of education, along with a fee for payment. Accreditation is a formal process where a healthcare organization meets determined and published standards. Accreditation standards are usually regarded as achievable and optimal and designed to encourage continual improvements. Accreditation is usually a voluntary process where organizations choose to participate and are not required by law or regulation. Licensure standards are intended to define the quality level that is necessary in order for patients' care or health services, such as drug dispensing. The standards also define the capabilities that are needed in order for a health organization to advertise to the public that it is a hospital or a health center. For example, licensure standards in a particular area might require that a healthcare facility provide certain services such as surgery, radiology testing, around-the-clock nursing, pharmacy, or lab services, maybe, in order to be classified as a hospital. Unlike accreditation or certification, which is usually voluntary forms of external evaluation, licensure is always mandatory. The government's granting of a license to an organization signifies its permission to the organization to be open and provide care or services to patients. Accreditation addresses organizational rather than individual practitioner capability or performance. Unlike licensure, accreditation focuses on continuous improvement strategies and achievement of optimal quality standards rather than adherence to minimal standards. Accreditation standards are typically developed by a consensus of healthcare experts, published and reviewed and revised periodically in order to stay current with the state-of-the-art thinking about healthcare quality, advances in technology and treatments, and changes in health policy. Depending on the scope and philosophy of the accreditation program, accreditation standards may take a systems approach that is organized around key patient and organizational functions and processes, such as patient assessment, infection control, quality assurance, and information management. Alternatively, standards may be grouped by departments or services within a healthcare organization, such as nursing, pharmacy, and maybe radiology services. The major purposes of accreditation include the following. Licensure is always conferred by a governmental entity or its designated agent, such as a licensing or regulatory board, state, provincial, or national medical or nursing board, and it addresses the minimal legal requirements for a healthcare organization or practitioner to operate, care for patients, or function. Unlike accreditation or certification approaches that are based on optimal and achievable standards or a demonstration of special knowledge or capability, the purpose of licensure requirements is to protect basic public health and safety. There are several national organizations and initiatives that promote quality improvement in healthcare. This section will highlight these organizations. The Joint Commission accreditation can be earned by many types of healthcare organizations, including hospitals, doctors' offices, nursing homes, office-based surgery centers, behavioral health treatment facilities, and providers of home care services. They help organize and strengthen patient safety efforts. They strengthen community confidence in the quality and safety of care, treatment, and services. They provide a competitive edge in the marketplace, improve risk management and risk reduction. They may reduce liability insurance costs. They provide education to improve business operations. They provide professional advice and counsel, enhancing staff education. They provide a customized intensive review, enhance staff recruitment and development, provide deeming authority for Medicare certification, and they are recognized by users and other third parties. The National Committee for Quality Assurance is a private, not-for-profit organization dedicated to improving healthcare quality. The NCQA seal is a widely recognized symbol of quality. Organizations incorporating the seal into advertising and marketing materials must first pass a rigorous, comprehensive review and must annually report on their performance. For consumers and employers, the seal is a reliable indicator that an organization is well managed and delivers high-quality care and service. The NCQA's programs and services reflect a straightforward formula for improvement. Measure, analyze, improve, repeat. NCQA makes this process possible in healthcare by developing quality standards and performance measures for a broad range of healthcare entities. The Health and Medicine Division, the HMD, is a division of the National Academies of Sciences, Engineering, and Medicine. HMD's aim is to help those in government and the private sector make informed health decisions by providing evidence on which they can rely. Each year, more than 3,000 individuals volunteer their time, knowledge, and expertise to advance the nation's health through the work of HMD. Many of the students that HMD undertakes are requested by federal, or many of the studies that HMD undertakes are requested by federal agencies and independent organizations, and others begin as specific mandates from Congress. The Agency for Healthcare Research and Quality, or the AHRQ, invests in research on the nation's health delivery system that goes beyond um, the what of healthcare to the how. The AHRQ creates materials to teach and train healthcare systems and professionals to put the results of research into practice. They also generate measures and data used by providers and policymakers. They are the lead federal agency charged with improving the safety and quality of America's healthcare system. The Medicare and Medicaid Services (CMS) Center for Clinical Standards and Quality, led by the CMS Chief Medical Officer and the CCSQ leadership team, is a group of professionals with diverse backgrounds in clinical, scientific, public health, legal, IT, project management, academic, and business management fields. The CMS Quality Strategy, similar to the NQS, the CMS Quality Strategy was developed through a participatory, transparent, and collaborative process that included the input of a wide array of stakeholders. For more than a year, a group of leaders from across CMS met and developed the strategy CMS objectives. For each of the goals, the CMS Quality Strategy identifies quality-focused objectives that CMS can drive or enable to advance these goals. Quality interventions are inherently interrelated, so many goals include concepts that could be articulated under more than one goal. Although no single activity can offer a total solution for dealing with medical errors, the combination of activities proposed in To Err is Human offers a roadmap toward a safer health system. With adequate leadership, attention, and resources, improvements can be made. The Institute of Medicine, or the IOM, concluded that it is not acceptable for patients to be harmed by the health mistakes that can best be prevented by designing the health systems at all levels to make it safer, to make it harder for people to do something wrong and easier for them to do it right. Of course, this does not mean that individuals can be careless, but when an error occurs, blaming an individual does little to make the system safer and prevent someone else from committing the same error. The changes needed to realize a substantial improvement in healthcare involve the healthcare system as a whole. The new rules affect the role, self-image, and work of frontline doctors, nurses, and all other staff. American healthcare is beset by serious problems, but they are not intractable. Perfect care may be a long way off, but much better care is within our grasp. The committee believes that achieving such a system is both possible and necessary. The National Quality Strategy Annual Progress Reports has three aims that are to improve the overall quality of care by making healthcare more patient-centered, reliable, accessible, and safe. Healthy people communities improve the health of the U.S. population and supporting proven interventions to address behavioral, social, environmental determinants of health in addition to delivering high-quality care. Affordable care, reduce the cost of quality health care for individuals, families, employers, and government. And six priorities make care safer, ensure each person is a partner in their own care, promote communication, promote effective prevention, and work with communities and make quality care affordable. The nursing home quality measures come from resident assessment data that nursing homes routinely collect on the residents at specified intervals during their stay. These measures assess the residents' physical and clinical conditions and abilities, as well as preferences and life care wishes. These assessment data have been converted to develop quality measures that give consumers another source of information that shows how well nursing homes are caring for their residents' physical and clinical needs. That concludes this presentation. Thank you for attending.